For my final course project, I will be focusing on the increasing rate of mental health disorders. As mental health disorders are becoming more normalized and talked about in society today, it makes me wonder, are we just hearing more about mental health disorders, or are the rates actually increasing? Mental health disorders or illnesses are health conditions that involve an individual's emotions, thinking, or behavior. Mental health disorders result in the functional impairment that affects or limits the individual's daily activities. This includes social, work, or family settings. Mental health disorders need to be diagnosed by a professional, like a psychiatrist, psychologist, counselor, or medical practitioner. Examples of mental health disorders include but are not limited to anxiety, depression, bipolar disorder, and schizophrenia. Each mental illness has a degree of severity and impairments that come along with it. As mental health disorders can be a sensitive topic and is private, it would be inappropriate for me to conduct the research or survey personally. All research and data I use will come from a mental health study directly, the American Psychotics Association, and Health Canada statistics. In the early 14th and 16th century, it was commonly thought that a mentally ill person made a pact with the devil and therefore was considered a witch. They were then tried by the courts, often convicted, and burned to death. It is estimated that tens of thousands of mentally ill people were condemned and killed in these trials. In the 1800s, people who were seen as odd or unusual were housed in asylums. This not only included the mental ill, but also included the disabled and deformed, among many other people. The focus of the asylums were not to treat the mentally ill, but were often to ostracize them from society. The people housed at these places were often beaten, experimented on, tortured, chained, among many other things. In the 1950s, society started to change their view on the mentally ill. Society argued that the mentally ill deserved humane treatments and treatments for their illnesses. This movement led to the release of many asylum patients. Mentally ill people started to receive medication and treatment for their illnesses. Presently, mentally ill people are no longer ostracized from society. Awareness and acceptance are being brought to mental illnesses. There has been new humane research, studies, and treatment. There have been a shutdown of the old asylums and instead brought in psychiatric hospitals. The main goal has now shifted towards treatment, awareness, and acceptance of these disorders. From 1982 to 1994, the Canadian government has seen a rise of mental health disorders in the general hospital and psychiatric hospitals. As you can see from Table 1, there is an overall incline in the number of people admitted to the general and psychiatric hospitals for mentally ill people each year. There is also a growing emphasis on community care, where people are treated as outpatients. The substantial annual fluctuation shown is an increase of 5,000 to 6,000 people per year. These are not shown in the charts as they were not documented in the same study as them. There has also been a rise in the duration of hospital stay for both general hospital and psychiatric hospital. Table 2 shows that the steady increase of duration stay is in both the general and psychiatric hospitals. In 1982 to 83, the average general hospital stay for females rose faster than males at 30% to 12%. By 1993 to 94, females averaged 36 days and males averaged 29 days. It is also stated that in general hospitals in 1993 to 94, 55 to 60% of their patients were females. In psychiatric hospitals, the average stay of males rose faster than females at a rate of 98 versus 59. Overall, in psychiatric hospitals, females averaged 342 days, while males averaged 316 days. Table 3 shown in the slide shows an increase in duration in both male and female patients in the general and psychiatric hospitals. In 2017-2018, Statistics Canada surveyed mental health and asked people to rate their mental health either as very good or excellent or fair or poor. Across the different age groups they surveyed, it was found that on average, 7.35% of participants rated their mental health as fair or poor. It on average went up by 0.7% across all age groups from 2017 to 2018. These statistics can be seen on the slide. The National Alliance on Mental Health Illnesses estimated that 43% of adults get treatment for at least one mental health issue each year. This can be seen in Table 5 on the slide. Of that, 63% of individuals have severe mental illness. The majority of youth aged 6 to 17 years old at 51% are receiving treatment for at least one mental health disorder. This can be seen on Table 6 on the same slide. Treatment for these mental health disorders include, but is not limited to, counseling and medication. The main difficulty I found in this research project is society's view on the mentally ill and how that translated to treatment. Not all people with mental health issues will seek out treatment or a diagnosis. It is also challenging to get a full picture of historically who was mentally ill due to poor record taking. It is difficult to find accurate records on treatment numbers up until the early 2000s. This makes it difficult to see the precise trend of incline in mental health disorders. It is also difficult to see if more people are actually developing these disorders or if more people are seeking treatment for these disorders. Overall, it is easy to see that the diagnosed rate of mental health disorders is going up throughout the years. And these are the references I've used.